Hello and welcome to Kitsap Community Resources Housing Presentation. My name is Matthew Garrett. I'm the Housing Community Support Services Director, and we're going to be talking a little bit about our programs, how to use them, how they operate, the referral pathway, and more. So we are glad you are here. First, I want to say a big thanks to Gather Together, Grow Together, who's helping us live stream this and record this and make this presentation available through their website and on their YouTube channel, The Conduit. Big thanks to them. So the reason we're having this presentation is we had multiple community service providers ask for updates on how KCR is working. And this is really understandable as a lot has changed since the COVID-19 pandemic. There's a lot of new programs, there's a lot of new staff, and there's a lot of change, and there's more change to come. So that's where we're coming from right now and what we want to do. We want to provide a training that's geared towards service providers, specifically in Kitsap County, and those providers when they're working with KCR. So to help them work with KCR, to help them understand our programs, to help them navigate the Housing Solution Center, and to better and more effectively serve clients. So that's where we're at right now, and that's what the presentation is here. So anyone in the community is welcome to watch, but we are definitely gearing with our lingo, with the slides, and with the presentation more towards agency partners in Kitsap County that are working in housing and homelessness or working in fields related to housing and homelessness and working with the Housing Solution Center or working with Kcr Housing team. So thank you so much again for being here, and we will get started. So on our agenda today is we talk a little bit about the change, crisis, and confusion that has kind of happened since the pandemic. We'll talk about the KCR teams. We'll review team functions. We'll talk about the referral pathway, working with the Housing Solution Center and where we're going, and then a little bit about some of the individual programs and eligibility. So first, change, crisis, confusion. All of us in the service provider community, all of us working in housing and homelessness, really understand that this has been an incredibly difficult time. There is a lot going on, a lot has changed for all of us, and all of our agencies have taken on an incredible load, and KCR is no different. And so the first just wanted to say thank you. We know some of our communication hasn't been perfect. We know a lot of stuff has changed, and this is kind of an attempt to try to communicate and have more clarity and transparency around our programs and how to access them. Part of this reason is the name of the game for everyone right now, which is staff, right? We've created so many new positions. We've created an entire new team and essentially tripled our housing staff. We used to just have a Housing Solution Center team and a housing team, and now we have a third rent assistance programs team, all dedicated to housing and homelessness. We've added more than 8 new programs since the beginning of the pandemic, and that has added a tremendous load to our staff. And we know our service delivery has sometimes been affected. Now we've greatly ramped up how many clients we're serving. We're serving more clients than ever. We're serving more diverse clients than we ever had before, and we're also using more money than we ever had before. And that's due to the great partnerships with the Department of Commerce and Kitsap County that we're able to do that. However, we do want to acknowledge that sometimes it's probably been difficult to understand the changes. We know clients have had difficulty understanding. We know service providers have had difficulty understanding all of this new change, and us explaining it hasn't always been adequate and has led to a lot of confusion. And that's partly what we're trying to rectify here today. And currently, we are still hiring and short-staffed. We are still looking to add positions. Case managers, specifically right now, is the #1 position that we need. So the moral of this is we know we've been far from perfect. We know it's been difficult, and we definitely appreciate all of the patience, especially our partner agencies in working with us. And hopefully this will help, and we hope to continue to increase communication and streamline processes as we stabilize a little bit in the later stages of the pandemic. All right, so overall, so the Housing Community Support Services Division. So this is the division that I work at and that all of our housing teams are under. And so it's actually made up of 6 teams. So there's weatherization, there's Housing Solution Center, housing, energy, rent assistance programs, and veterans. Today, we're really going to be focusing on the 3 housing teams. So the rent assistance programs, which is managed by Carla Foster, the housing team, which is managed by Brenda Johnson, and the Housing Solution Center team, which is managed by Jasmine Castorina. And really, we'll be focusing mostly on engaging with Housing Solution Center and then housing, because that's where the bulk of our homeless services are really located under those 2 teams. The rent assistance team is very prominent, but they really focus on eviction prevention, folks that are in homes. And so that's kind of the broad structure of the division. And what does each team focus on? So weatherization makes homes more energy efficient for low-income residents. They do heating system repairs, insulation, sealing, and more. Energy helps with folks that are behind on their electric, their gas, their heating bills for low-income residents. The Housing Solution Center is coordinated entry for the unhoused community members in our county, and we'll talk much more about that later. And then the housing team itself manages our homeless service programs that provide case management and housing assistance. So that's a key distinction that we'll be talking about, is coordinated entry, referral service, which is Housing Solution Center, and then our housing team, which actually runs homeless service programs and actually manages and case manages those clients. Our rent assistance programs team, they provide rent and utility assistance for low-income renters at risk of eviction. And our veterans team provides financial assistance for low-income veterans. That's a team of 1, and that's Gary. He is awesome. So team is maybe a little bit of a misnomer, but it is a separate program. All right, so our process. So I've got some nice diagrams. So everything starts with Housing Solution Center. And so Housing Solution Center serves as coordinated entry. So it serves clients that are experiencing homelessness or at imminent risk. It's the starting point for all homeless services. They do an application, they do a vulnerability assessment and HMIS entry for everyone that walks through the door. And we'll talk a little bit more about that. And they make referrals. That's what I was talking about just a little bit ago. They refer to different housing programs, shelter, resources, and they have some rent assistance on their own, in addition to our RAP team and in addition to our housing team as well. But they don't do case management. So this is funding only. So that's the first piece. So let's talk a little bit more about some of these. So coordinated entry, and I do have some diagrams coming. So I promise we have some visuals to help. But coordinated entry is the starting point for homeless services. So the idea of coordinated entry is that someone who is experiencing homelessness or at imminent risk can go to one place to find out the resources that are available. They don't have to go to all the different individual agencies throughout Kitsap to figure out if they can get assistance or if they can get help. So that's the idea of coordinated entry. It's not perfect. It's far from seamless, but we have a really good system that does work pretty well. And that's what Housing Solution Center is. They're coordinated entry. So you come to Housing Solution Center, and then from there, you can get connected to resources. So the application, so there's an HSC application. So any client that comes in fills out this HSC application. It has a number of questions about where they're coming from, where did they stay last night, demographic info, name, and more about their specific situation. We also have a vulnerability assessment attaches to that, and that's important because all clients fill out this vulnerability assessment regarding their current situation, where they come from, are they exiting a system of care of some type, do they have certain disabilities, are they experiencing mental health, substance use? And so what this tool does is allow us to make a quick assessment. Again, far from perfect. It doesn't capture the totality of humans, but it's a way for us to help prioritize resources, which that'll keep coming back up. And then they enter into the HMIS, which is the Homeless Management Information System database. So that's required for all housing programs that run through the Department of Commerce. And that is the database in which we track, we report, and we make sure that we're not duplicating services. Clients can opt in or out, so they can we can still use it. We still enter in for everyone, even if the client doesn't want to opt in, and that is solely up to the client. If they don't opt in, we just have we call it de-identified. We just have a number in there for them and not any identifying information, and that is perfectly fine. So that's roughly how Housing Solution Center works at a process level. And then here's our housing team, and Housing Solution Center are very different, right? Housing Solution Center, Housing Solution Center is coordinated entry. Our Kcr Housing team actually provides homeless services, case managed services, actually runs programs. So you have referral service, and then you actually have a homeless service provider. And Housing Solution Center and Kcr Housing team are both housed under Kitsap Community Resources. And we know this is confusing. And oftentimes those two teams are confused, even though they serve very different functions within the community. And that's partly what this PowerPoint presentation is hoping to address. So the housing team, they accept referrals for qualified applicants from Housing Solution Center, right? So everything still starts at Housing Solution Center. Referral comes to the housing team. And then we have kind of three broad categories of programs, right? We have rent assistance. So that's rent assistance in the community for folks that are experiencing homelessness. And we have a variety of types, but that's a broad category. We have transitional housing. So 15 units of transitional housing. And then 3 units that is much shorter term that we call kind of an emergency family shelter program. And we also have long-term. So we have 19 long-term units for dedicated towards households, families that were experiencing homelessness. All of these programs through Kcr Housing Team are offered case management services. We also, during the pandemic, we were given priority to clients that were in shelter. That has actually recently changed to now we are prioritizing back to how we usually operate, which is by the vulnerability assessment. And that's why I mentioned that earlier with the Housing Solution Center, because that vulnerability score for when resources are limited is how we prioritize. Assistance team. So the rent assistance team accepts qualified applicants from Hsc for rent assistance team programs. Now, Hsc doesn't do the normal homeless service process because a lot of these folks aren't unhoused. Most of them, and really by definition, they're in housing and they're at risk of being evicted. And so the rent assistance team runs our KEPA program, our Kitsap Eviction Prevention Assistance Program. So that's a variety of funds that are all dedicated to preventing folks from being evicted during the pandemic. So it's eviction prevention. And if folks come in, they're put on a different pathway than our unhoused clients. So they actually are on a wait list as opposed to actually seeing a navigator and accessing services a little bit more quickly. And this is just because of the volume of clients. So there's thousands of clients right now that have been served through our rent assistance team, and hundreds are coming through per month. Just this past month, we had around 227 folks that were added to our wait list that applied for assistance, whereas on the Hsc side, they see between 100 and 150. So it's a lot higher volume of clients every month, and there's a lot more clients that qualify. Clients can apply directly through kcr.org because it's a more simplified application, so that can happen online. Clients can receive help with rent and utilities. And we do have some limited help for low-income homeowners with mortgage assistance. As promised, here's the referral pathway and some diagrams. So Clients that are eligible for our programs fall into really 4 categories. So there's imminent risk. We have systems of care. That's exiting a treatment center. That could be exiting jail, hospital, mental health institution, behavioral health institutions. That's what we mean by system of care. Folks shelter, if they didn't go to get placed through HSC into shelter, we definitely want to screen them to see what other resources they're eligible for. And then place not meant for human habitation. That's kind of the classical definition when we talk about our unhoused community, right? That's could be a car, an abandoned building, tent, encampments, those types of places. So all of these folks, right? The first stop is HSC. We talked about that coordinated entry. And that's why we have that in blue right there. That's kind of unique. Even though HSC is housed under the same 1201 roof as our housing and RAP team, they serve that first initial stop, coordinated entry, right? They want to be the first point, the entry into our homeless service system, our continuum of care in Kitsap, and they want to coordinate that, hence coordinated entry. And then they make referrals to different agencies, including our own. And so what I wanted to draw in this red circle here is this is actually kind of housing resources, right? So HSC does a variety of referrals, and we'll talk a little bit more about the different types. But in broad terms, so they can refer to themselves, because HSC has some rent assistance through our Roast and Harps program. So they can very quickly, just someone comes in for an assessment and they can get rent assistance. And those are for folks that are experiencing homelessness and are moving into a place, so more of a rapid rehousing type program, and also eviction prevention. But these programs here have a focus on mental health, folks that are experiencing behavioral health or substance use. And so that's really the priority for those programs. So HSC can just take care of rent, but again, this doesn't come with case management. This is not a case managed program. This is very short, quick, assisting with rent, but not long-term, not enrolled in an ongoing program of case management. HSC also refers to shelter, and there's different types of shelters in Kitsap County, and HSC maintains the priority pool. So there's a few shelters that HSC directly refers into, and those are different from the drop-in shelters or the DV shelters, and we'll talk a little bit more about that in a second. But this is one of the primary functions, is get these folks, especially folks, right, place not meant for human habitation or system of care. Those are folks that have no other place to stay. We try to connect to shelter. HSC also refers to outside agencies' housing programs, such as Agape or Pendleton Place. Some caveats there. It's not just open referrals. The agency has to have a spot, but that is one of the functions. And then HSC can also refer to Kcr housing programs, right? So we get all our referrals from the Housing Solution Center. And notice these are 2 different boxes, 2 different teams, Housing Solution Center, and then we have Kcr housing programs, which takes into account the kind of the 3 broad categories: rent assistance, long-term housing, and transitional housing. So in kind of the red box, these are all kind of housing referrals, right? But HSC still does community referrals. That could be to DSHS or some of the other community partners, St. Vincent de Paul, food banks, when needed. So the Housing Solution Center, we do a lot of different things. And that's kind of all outside of housing, that all falls under the community referrals. Sometimes there's bus tickets available. So there's various other programs that we do have. We have hygiene kits, internal, and also we let other folks know about resources at other agencies. And so there's the community referrals, but that's not necessarily housing related. That could be responding to urgent needs or imminent needs of the client. But this red box again is kind of the housing specific. So here's the general referral pathway. Okay, so HSC and housing integration. So the teams work really closely together. So we talked about there being a few different types of assistance. My apologies. And there's multiple types of programs. And this describes a little bit better how HSC actually interacts. Now, Housing Solution Center has folks, maybe the traditional kind of Housing Solution Center, what folks think of is we actually have a building at 1201 Park Avenue in Bremerton. And we have a number, usually 3 to 4 navigators here at any given time. We also have a navigator at Fishline in North Kitsap, and we have navigators that rotate at our South Kitsap site. So we have some geographic diversity throughout Kitsap County. So folks can be not all seen at Bremerton, although Bremerton is the hub. That's where most of the operations happen. However, we also have outreach teams, and those outreach teams play a critical part in getting folks connected to HSC's services and getting connected to housing programs in general. And we have 2 types. We have the ROAST outreach team and the HEART outreach team. And so we'll talk definitely a lot more about how those teams work. But again, we have our 4 broad categories: imminent risk, system of care, shelter, place not meant for human habitation. And so kind of like the same arrows as before, these folks can all come to HSC for services. That's fine. And we can make referrals if they actually come into HSC. But we've been investing in building our outreach capacity so that we're not waiting for folks to come into the door, because we know there's a lot of folks that don't come in for a whole variety of reasons. Lack of trust. They've come in and haven't gotten a resource in the past. Accessibility. Some don't even know. And so that's why we have outreach teams. And so the ROAST outreach team focuses a little more on the system of care, treatment centers, behavioral health. They'll go to crisis triage, Pacific Hope and Recovery. They'll go to the jails. And so they're more focused on some of the systems of care, especially folks that are experiencing mental health or substance use issues. Our HEART team is our homeless encampment action response team. And that is part of the county's HEART team. So we have a piece of that. We're not the only folks. They focus on place not meant for human habitation, specifically homeless encampments in Kitsap County. So they also will go to shelter, and sometimes at imminent risk, but not much. But essentially so we have folks that can come in, and we also have outreach workers that can go out. And both teams are filled with navigators, although one is primarily focused in the office and the other are primarily out into the field. They're actually with clients, meeting with folks, going to treatment centers and so on and so forth. But they both fulfill the same function, navigators, and both fulfill coordinated entry. It's really just kind of where they are. They both can connect clients to the ROAST or HARPS rent assistance programs. They can help sign them up, get them connected. They can still refer them to other programs within KCR. They can still refer them to external programs. But right here, just focusing on the relationship of KCR systems. So that's why I don't have them referenced here. But to the point is they're all navigators. They all have the same ability as navigators. Now, what we're seeing with outreach is that they're actually doing some kind of light case management. And so we are looking at moving in the future into a more hybrid model where some of the outreach folks can actually start doing some of the case management while they're out into the field. But that's going to happen slow and piece by piece. But that's one of the what we've been seeing and what really is needed when we're connecting folks, especially in the encampment world. So again, here's kind of HSC programs up here. And then we have all our KCR housing programs up here, or down here. So we have HSC, Housing Solution Center, outreach, coordinated entry, and then also running the ROAST and HARPS program, the rent assistance side. Then HSC refers into I have that kind of 3 broad buckets. We have our hotel program, we have our rent assistance program, and then our housing units, right? This is the long-term, the emergency and transitionals all in that bucket there. So there's kind of 3 broad programs that HSC or the outreach folks can refer into. And this is kind of how HSC interacts with the housing team. So you have coming into coordinated entry, going out to different areas on the outreach, connecting to roast or harps if needed. But if that doesn't work, then both sides can refer into the actual housing team into the different programs. This is not a comprehensive list. This is just kind of 3 broad buckets of different types of programs, like I talked about earlier. But what I hope this illustrates is the different or how HSC interacts with the housing team, right? So these are all run by the housing team. That's why I put Kcr Housing, Kcr Housing, Kcr Housing. And then up here is Housing Solution Center, HSC outreach, roast and harps programs through HSC. And then another diagram that I drew to kind of help, a little crude compared to the others, but I thought it might be helpful just visualizing clients coming to HSC. HSC is at the heart of our system. They refer to all the different KCR teams, right? They can refer over to Kcr Energy, to Kcr Housing team, Kcr Raptor team, and outside agencies. Right now, Kcr Energy has their own intake process. So even when HSC makes referral, there's still an intake. Same with the Raptor team. They kind of have a separate intake, but HSC will get them to the right spot. And then HSC will make direct referrals to the housing team. They have that kind of more direct relationship. And outreach teams. So I'm talking a little bit more about outreach teams. We talked about the difference between office and outreach. So the outreach folks and the outreach are really out in the field doing the encampment work or at the treatment or the behavioral health facilities, whereas our folks in the office are much more at a specific location when folks come in, working with folks that come in. So although all are navigators and essentially can do very similar work as far as referring, the actual where they are and who the population it is that they're targeting, that's really the difference, like we talked about. Then the Kcr Heart team, they have that encampments focus, part of and led by Kitsap County. It's part of that homeless encampment and response team. The ROST stands for Recovery, Outreach, and Stabilization team. And so there's 2 sides of that, and that's further confusing. So the ROST side has an outreach side and coordinated entry housing solution side, and it has a housing component. So there's a case management component for high barrier clients. And then there's also a rent and outreach component for folks that are treatment facilities, behavioral health, that have a mental health. All of the clients have a mental health, substance use, or both diagnosis. But the ROST outreach team, systems of care, jail, treatment centers, behavioral health facilities, etc., like we talked about. And they're each teams of 2. All right, working with Housing Solution Center. So referrals and outreach is primary function. They do not operate housing or case managed programs. So when a lot of people come to Housing Solution Center, and again, I know I've been beating this drum, but they think Housing Solution Center and our Kcr Housing team are one, and that they'll automatically get onto a program. Getting onto a program depends on multiple factors: availability, case management load, funding. So there's a lot of different factors of why they might come to Housing Solution Center and not get connected to a program. And we often wish that we had resources and the staff to serve anyone that came through the door. And hopefully one day we'll get there, but we're still not there yet. And that's why we have to play these vulnerability games or these prioritization games, which are enjoyable by nobody, but they're a necessary part of how we operate to try to prioritize resources for the most vulnerable, given that we have limitations and cannot serve everybody. But HSC, they don't exclusively make that decision. So other agencies or Kcr Housing, we let them know when there's slots available. And so then Housing Solution Center, they don't control all the different programs. They just refer when they're open. The same with shelter. The shelters let them know when spots are available. but that's not Housing Solution Center. So Housing Solution Center's role is not to house or case manage or just enroll them in programs, right? Remember, they're referral agency, so that when stuff is available, that's when they actually refer in and open up slots. And that goes for our outreach folks and our office navigators. We talked about coordinated entry, gateway to service, come to one spot to see what is available. Now let's talk about the referrals that they can give. So there's a shelter referral. They can do rent assistance through Hsc, which we talked a little bit about. They can do a referral to a housing program through Kcr. They can do our rent assistance programs team, so they can refer to, we call it the RAP team. And these are really the eviction prevention folks. They can refer to housing programs outside Kcr. They can do general community referrals like we talked about early on. And then in certain cases at BHA's request, we can help with wait lists for certain projects when needed, but that's not necessarily year round. So first type, the shelter referral. So there's 3 different types of shelter referrals. There's the direct referral, there's the drop-in shelter, and the DV, the domestic violence referrals or shelter types. So the first referral type is kind of this direct. These are for continuous stay shelters, meaning folks are accepted into the shelter and they stay there for a period of time. Folks that are in this category are Benedict House, run by Catholic Community Services, George's House, Stella Maris, St. Vincent de Paul, and Kitsap Rescue Mission. These are all programs that Hsc directly refers into, meaning you cannot go to George's House and get into the shelter. There are some folks call it a waiting list, but it's really not a waiting list, and we don't want to call it that because it doesn't function like a waiting list. There's not a waiting list for a shelter. It's a priority pool. It's by vulnerability. So we call it the priority pool because these are all the folks that are requesting shelter, and the folks that get it are the ones that are the most vulnerable. So it's not a wait list as in someone comes in at the beginning of the month, and if someone comes in after, they get slowly added. It is a priority pool, meaning whoever has the most vulnerability goes to the top of the list, is next in. So you could have someone that's second or third, but if people keep coming in that are more vulnerable, they will keep getting bumped down, down, down. That's why we don't really give out the numbers of where they are, because they don't really mean anything, because new folks can come in, and if they're more vulnerable, they will be served. So what we just let clients know is they're on the priority pool. We can't really give them a timeline of when it'll open up if it's full, but we do work with them on other solutions when the shelters are full. So there's drop-in shelters. So the Salvation Army and Severe Weather Shelter are examples of this. So we don't do a direct referral, but we do a lot of indirect referrals. And essentially the Salvation Army folks can just go there, and that's what they kind of mean by the drop-in, is that they can actually go and then stay. And Salvation Army has a little different set of rules than the other folks, but it's the big difference as far as Hsc goes. It's not a direct referral. We just direct folks over there when we know that they have openings, and then Salvation Army does their own intake. Same with the DV shelters. So it's not a direct referral as in we control the priority pool. They have their own specific intake. It's a different process. And so we'll just work with the DV shelters when we have folks that we think are a good fit, and when they have availability to try to make that connection. But we don't do really that intake or control that inflow. They do that on their own. So those are the 3 shelter referrals. Rent assistance direct from Housing Solution Center. So we talked about these 2 programs, ROAST and HARPS. Recovery Outreach and Stabilization Team, and then we have Housing, I think, and Recovery Peer Supports, I want to say. There's a focus on eviction prevention and rapid rehousing for community members that are experiencing behavioral health or substance use. That's really the focus for these 2. Now, ways that you all service providers can help get clients document ready. That's a big thing that smooths the process. Is everything requires qualification, eligibility. screening, and there's documents that are required for that. That's what we mean by document ready. So really for these two programs, this is what you need to get them document ready. Identification. So they do need an ID. There's a verification of past 30 days of income. Now, if they're just on TANF, ADD, Social Security, we can verify this through the benefit verification system. And so we have that ability to, so we don't have to collect a letter. We don't have to have someone go to DSHS to collect a letter to get that verification. We do need, though, verification of services with a diagnosis. The diagnosis is not needed in letters from Kitsap Mental Health Services. That's because Kitsap Mental Health Service has the other side of the HARPS grant. We have the housing piece, but the peer support comes from Kitsap Mental Health. So they're the other grantee for HARPS. And the verification of services for folks not in Kitsap Mental Health Services, we do need a diagnosis of some sort. There's also verification of homelessness for folks that are unhoused. So if you're a service provider and working with someone you know they're homeless, please write it. Any service provider, community member, pastors, really any professional that's working in the field can write a verification of homelessness letter in order to qualify them for either of these two programs. Or if they're at imminent risk, we need a 14-day notice or a ledger to show that they're behind on rent and at risk of eviction. We also need a lease or the house rules, depending on if they're going into apartment or they might be going into Oxford House or another type of housing. We also need landlord paperwork. So there's paperwork that the landlord has to fill out and that they need to fill out in order. It's like an agreement of, we're going to give you money, you house this person. Pretty basic. And then a current HSC application, as we talked about earlier. Referrals to Kcr housing programs. So we talked about the difference between HSC and housing, and HSC does refer into our programs. So we prioritize based off vulnerability, very similar to what we talked about with the priority pool. So we have Kcr Housing Units. So we call it the community interest queue for, instead of the priority pool, to differentiate it, but it's essentially for families that meet the criteria that have come through Housing Solution Center in that current year. That's who's eligible for our housing units. So we have 36 units total, 3 family shelter, 15 transitional, and 19 long-term. And we pull right from the list of folks that have come in, families that have come in that are unhoused, that are requesting assistance. And because we actually have case managers attached to that, so Housing Solution Center doesn't really do too much. If they have documentation, they'll assist, but usually at this point of helping clients get through the qualification process, that's when case managers come in, since they are available. Our Kcr ROAST program. So this is the high barrier case management. So this is not the rent assistance outreach side. So there's the recovery outreach, that's half the team, and stabilization. So there's the ROAST outreach team, but here's the stabilization team. So there's actually 2 case managers and a therapist that are embedded to be a kind of a high impact team. And the 2 case managers have a smaller caseload. And these are the highest vulnerability scores that HSC has. So these are unhoused folks, typically with comorbidities and chronically homeless. So homeless out on the streets, unhoused, longer than a year, some longer than 5 or 10 years. They have mental health, substance use, and often pretty intense medical and physical health issues and disabilities. So that's our ROAST team focus and prioritization. And HSC makes those referrals. So they identify these folks based on vulnerability and then refer to this team. A lot of the encampment folks that we're working with recently, especially many have heard about the Veterans Park. A lot of those folks went to this ROAST team since that was the best fit. Then we have community rent assistance, and we have a lot of different programs here. And I mentioned just mainly kind of some broad categories that kind of fit most of the different programs. But so we have move-in only assistance. So this is assistance. A lot of times folks that have a Section 8 or another long-term subsidy. Or it could just be folks that are, we have a whole unhoused community that's working. They have the funds to go forward, and they just need, that $4,000 to $6,000 for move-in costs. Move-in costs are really expensive, so that's what this program is for. Just move in quick, very light case management in the beginning. They're kind of in and out. We have our standard rapid rehousing program, and that's where folks come in. They get 6 months of assistance, and then they graduate from the program. And they generally pay a larger and larger increase or percentage of the rent as they stabilize. Both of those first two programs, the client finds the landlord and they have to be open. So they aren't always open. We really worked hard to keep move-in only open year round. However, that's recently had to close because of just staffing. We have so many folks that we've taken on right now. So we hope to open these back up really, really soon. And that's really what HSC's job is. They know the up-to-date what's open and what's not. Now, the other more intense programs, they start with Rapid Rehousing Plus. So this is really where a lot of the program that we combine the high barrier case management with Rapid Rehousing Plus, because this is the client doesn't have housing identified. Typically 6 months, although some of the high barrier folks can go up to a year or sometimes longer, depending on vulnerability. But if they're not in that high barrier, it's still 6 months is the standard. But the case manager finds housing, looks for housing, gets them document ready, works on long-term solutions if the private rental market is not going to work. So that's kind of the Rapid Housing Plus, is that catch-all because it includes so much more: housing, location, really long-term planning. Then one of our newer programs is permanent supportive housing for chronically homeless families. So this is permanent rent subsidy for chronically homeless families. So this is in the community, and it is permanent, and it's supportive housing. So that's permanent. Supportive is the case management piece. So there's a case manager that will be with them through the length of the program. And then it's for chronically homeless families. So this is families that have been, the head of household has been homeless for longer than a year. That's the definition for chronically homeless, or in the past 3 years have had different incidences that add up to a year. That also qualifies. And they also, the head of household has a disability. So these are vulnerable families that the head of household was chronically homeless and a disability, then they qualify for this program. It's smaller. We don't usually have many openings, maybe 1 or 2 a year. But for the families that are in that category, it's a very stabilizing program. Then our newest is the hotels. We're prioritizing encampment and vulnerability, as we talked about before. And the hotels are tricky, and I'll talk a little bit more about in a second. But there's limited actually hotels that want to participate in the program. And also, this is really high intense case management. Again, we pair it with our high barrier case management, but there's only so many slots, and there's so many folks that really fall in this category. So the hotels are really when there's not, these folks would not qualify or make it on the rental market. That's why we're trying to prioritize them for folks that are have significant barriers. And one of the limiting factors is that, but also is we need case managers in order to work with them in the hotel. That's kind of part of the relationship with the hotel. And so there is some limitations on that program of how fast we can ramp up. All right, Housing Solution Center, other referrals. So they can refer to the Rent Assistance Programs team, our RAP team. That's KIPA. They move to the wait list. They can apply online or in person when they come to 1201. So either way. We can refer to other housing programs outside KCR. So AGAPE is an example, Pendleton Place. Although Pendleton Place, it's not a priority pool like shelter. They pull just at anyone that's come in to Housing Solution Center, and then they pull the most vulnerable that fit their criteria. So depending on the place, it's not a perfect kind of like shelter where we actually place. It can be just coming in, screening, and then other agencies use that screening to meet their criteria and their needs. And that's perfect. We're very happy to partner with them. The Pendleton Place relationship has gone really well. Same with Agape. Then general community referrals. So that can be to DSHS or food banks. And then we talked about the BHA wait list when requested for certain projects and certain wait lists. All right. Other services. So here's a few other things that Kcr Housing Solution Center has to offer. So there's bus tickets and bus tokens. So bus tickets are for specific agencies. Please ask Housing Solution Center. Jasmine Castarain is the manager right now. If you reach out to her, she can get your agency bus tickets. This is for agencies to hand out for clients so that they can have a ride if they need to. And we manage that, and we distribute those out to different agencies throughout Kitsap that are working in the housing and homelessness world. So for details, please contact Jasmine. Bus tokens are for clients. So that's what we give out when they actually come in and a client needs it. So we give tickets to agencies. Bus tokens we give to clients, especially if they're having trouble with transportation. They come in and don't have a way to leave. That's typically when we use bus tokens to get folks to where they need to go after we've helped them. There's hygiene kits that we can hand out for those that are unhoused. There's also landlord lists that we do, and that's a really useful tool. So we give it out a lot. Folks ask if we have lists of landlords that we commonly use. These include all the tax credits, most of the subsidized units, and at least contact information. It's hard to update all the procedures, but we have a little bit of information about the subsidy and how it works, and if there's a wait list, if there's not, if it's open. We try to update this every month if we can. Usually ends up being every other month or every third month, because we do try to call around and actually update the list and actually get contact numbers. Is it available? Is it not? Is it closed? And so the last time we did that was in March, so about 3 months ago. So hopefully soon we'll be able to update it. We also do some diversion work. And so this diversion is really helping clients avoid actually going through the homeless service system to begin with, right? Avoiding maybe going through shelter, getting on a rapid rehousing program. This is designed really to divert them from homeless services. And the main way we do that is transportation. So if they are here, but they do have a relative that's willing to take them in for a bit, we can get them a bus ticket across country or train, but typically it's bus. And we can get them to where they need to go if that allows them to get off the streets or to get housed or to restore a relationship. There's a few other things we can do to that, but that's the primary way that we divert clients right now. Where we're going, we want to continue to increase outreach and support to the chronically homeless folks that are experiencing chronic homelessness. And we're already doing that a lot with the Heart team. They are outreaching to different clients that are in encampments, and they're building those relationships. We were very involved with Veterans Park. By no means was that an easy situation. It was very difficult, but through the tireless efforts of the Heart team, it was something like 85% of those folks ended up with some type of solution, whether treatment, shelter, a hotel. Not that that's long-term, but immediately we were very impressed with the Heart team and Kitsap County and what they were able to accomplish in a short amount of time. Very difficult situation, and encampment work is really, really tough and really complex, especially a lot of folks have really extensive networks and support networks in the encampments. And so moving them is complicated. We don't pretend that's easy. And we really try to handle that with care and respect as much as we can. We want to increase our case management through foundational community supports. We've really ramped up our FCS program, and that's hopefully what's going to allow us long-term to sustain increased case managers. So the idea is, even if folks don't have a program, we can start case managing. In the past, with some of our existing grants, you really have to have a slot for them. And so the program's open, close, and that will probably always will be to some extent with rent, with subsidies, because you have budgets and you have to plan to make sure you can follow through on your commitments and not overspend. However, the FCS is a fee for service. And if any other providers are not using FCS and have questions about using it, be happy to talk about our experience. But what we hope is to continue to leverage that to expand the case management. So if folks come in, the goal is to really have them at least be offered a case manager if they would like someone to start working with them through the process, even if there's not a program available. And we are slowly moving that direction. We've ramped up our FCS program completely, and we're really just starting to build some sustainability in that funding stream. It's definitely not easy. It's a lot of work, but that's where we're moving. And we have a lot of promise. We're really ending our pilot project for the past kind of year, 2 years, and now kind of into a more sustainable model. We want to increase the use of hotels through this next year. We don't know long term. Most of the hotel program right now is only slotted through June of 2023. So we want to ramp up in this next year. We don't know long term where that's going to go. We also want to increase the clients. I talked about FCS. That's kind of hand in hand, increase clients served in case management through FCS. And then we talked a little bit about moving to a hybrid outreach where the folks that are actually working with people in the community, in encampments, on our outreach team can start actually case managing them. And they're already doing that a little bit to some extent, especially what we saw at Veterans Park and even some of the other encampments. They're really starting to work with them, and building that trust really is case management. So we want to kind of go with where the need is, and that seems to be the need, is building that trust and already starting to do some work beyond just connection. So that's where we're going. Note on hotels. So right now there's really two different types of hotels. And even within the housing team, there's a few different types, but there's two teams that are using them a lot. So there's the rent assistance, there's our Kcr team. That's our RAP team, our rent assistance programs. That's all for folks, eviction prevention. This is actually probably the more commonly used hotel program right now, our Kcr program. And that's because if clients are displaced from housing, meaning they're being evicted and they cannot avoid the eviction, even with payment, the landlord is selling, the landlord's moving into the unit. There's kind of a few ways that the landlords are evicting. There's really no recourse, even if we're able to pay the landlord and get the tenant caught up. The tenant is being displaced. And in those cases, we can pay for a short period of time, usually a month or two. We start with a month, but if folks have a place lined up, we can go a little longer to get them to that bridge. It's kind of individual circumstance and what the hotels are willing to work with us. Again, the hotel programs are very dependent on what the hotel wants, and they really determine the rules. And because there's not landlord-tenant law, they really hold most of the power in dictating what happens in the terms. So there's not as much recourse as we have working with landlords. It's one of the downside of working with hotels. So you might see or run into folks that are, yes, Kcr put me in a hotel, but these folks are not case managed. They were coming from housing, so they weren't even unhoused when we started working from them. They just got displaced while we were working with them. And that's why we put them in a hotel for short term. This is not a long-term solution. Our team, the Kcr team, does not case manage either. They really advocate what they can, help deliver funds, get bills paid, utilities, rent, and then try to set them up as best we can. But they don't have the bandwidth to look for housing, case manage in depth, and find long-term housing solutions. So but this is pretty prevalent right now. There's more and more folks that are in this category of being displaced, have nowhere to go after their current living situation, and so that's when we'll use some hotels under Kcr. Now the housing team, this is what I think a lot of folks have heard about, right? The new hotel program. This is, we've ramped up as quick as we can for now. We just do not have the bandwidth to continue to scale. We have roughly 30, 35 right now that are in various kind of stages of the hotel program. Before pandemic, the hotels were so expensive, we didn't use them a lot, even though some of our grants allowed it. We would really only use it as a bridge between programs. So if someone had a place lined up and they were currently unhoused and we knew there was going to be an end date because we're going to help them move in, that's when we'd often use hotels because there was an end date, right? Short term. Since the pandemic, when the vacancy was lower and there was some increased funding, we started using, within our rapid rehousing program, we started using hotels as a way, as a stopgap, while our case managers worked with folks that were unhoused. It's a lot easier to work with folks when they're at least in a hotel and have the roof and some immediate needs met. And then we're using that as a bridge, typically around a year, to get into longer term subsidies, to stabilize enough so that we could get them into a longer term situation, whether that's assisted living, that's maybe a subsidized unit, or treatment. And again, those were really high barrier clients. So those were ROAST clients, stabilization team clients that were using it. Now we have this hotel, and it's program specifically dedicated for hotels. And we've really ramped up recently with Veterans Park, and we're just at capacity. We just don't have the staff right now to ramp up further. We hope in the next few months. We're hiring right now. We want to get more folks on to really ramp up this program and get moving. And that's really our goal, is to be able to, in these next few months, ramp up, but we're just not there yet. So we need to take a little bit of a break. We're working on increasing capacity to take time. So that's kind of where we're at currently on the case management side. And again, so I think community members, especially folks that aren't as vulnerable, maybe a little bit more stable, that's not really who we're targeting for the hotel program. Because we have such limited hotel rooms, again, we're trying to prioritize resources for the most vulnerable, and that's typically folks that are coming from encampments. Now, there's always things that could change. That might change if there's a lot more hotels that are willing to work with us, but I don't necessarily foresee that happening. We have limited hotels right now that are willing to work, especially willing to work with some of our more high barrier clients. And so there's also a supply side on hotel rooms that is limiting us as well as case management. So the hotels are a little tricky, and we don't just have hotels to kind of give out freely. It really depends on situation, depends on vulnerability, depends on staff. And so if you have questions, please call us, let us know. We'll let you know what's open. We're always open to community members advocating, especially service providers advocating for their clients and talking with us and what can we do. We're very open to that and kind of figuring it out and finding solutions. All right, so here's actually the current housing programs. And this is where we're kind of going to end with some of the eligibility. So as you can see, there's a lot of programs. So the Housing Solution Center, they have the Recovery Outreach and Stabilization team, which they focus on the rent assistance and outreach side, so the first part. Then they also have the Housing and Recovery through Peer Supports. Again, they're focused on the housing, just the rent, not the peer supports, the rent assistance. There's the Housing Encampment Action Response Team, and that's outreach. We also have diversion assistance. So that's kind of the 4 programs for clients that they run that have funding or outreach, assistance attached to it. Then there's the Rent Assistance Programs team. So under the KEPA umbrella, there's TRAP, there's ERA, and ERAP 2.0, which is coming. So there's various programs. We've actually gone through 1.0 and are now into 2.0. And you don't need to worry about the distinctions between that. That's just the funding sources if you're curious. TRAP is the Treasury Rent Assistance Program. ERA is the Eviction Rent Assistance. ERA is directly through the Department of Treasury. TRAP comes from Treasury, then goes to Commerce, then to Kitsap County. We also have CDBG COVID mortgage assistance that the Rent Assistance Program team runs. And then here's all the programs. I know I kind of put it in broad buckets earlier, but the housing team has a lot of different programs. So there's the ROAST High Barrier, there's ESG Rapid Rehousing, ESG Hotel Shelter, CHG Hotel, we have CHG Move-In Only, CHG Rapid Rehousing, Rapid Rehousing Plus, PSH for CHF, Emergency, Transitional, COC Rapid Rehousing, and then long-term. And so some of the funding sources, so for the Recovery Outreach and Stabilization, that's 1/10. ESG stands for Emergency Solutions Grant. CHG is Consolidated Housing Grant. and that funds most of our rapid rehousing programs. And RRH is rapid rehousing. PSH-CHF is the program I was talking about earlier, permanent supportive housing for chronically homeless families. There's Kcr Emergency Shelter, it's 3 units. We have Transitional, which is funded through the county, through the Housing and Homelessness Grant Program and the Affordable Housing Grant Program. Then we also have some of our transitional housing funded by the Continuum of Care. The Continuum of Care also has a component of that, that's rent assistance out in the community. And then we also have our long-term. And so there's a lot here about the different programs. So we'll talk about a few of the more broad ones. We've talked a lot about ROAST and HARP, so I'll spend a little less time and we'll talk more about CHG. So ROAST, so this is for the rent side and the stabilization side too, although the stabilization side, as I said, really focuses on those really vulnerable folks. There's eviction prevention and rapid rehousing, the 1/10 of 1%. They have to have mental health or SUD diagnosis or treatment under 50% area median income. They need to have an eviction notice, behind on rent, or proof of homelessness, or verification of homelessness, and that program can go up to 6 months. HARPS, housing recovery through peer services. Again, focus mental health, substance use. The HARPS program through the SAHE list, I think it's BHASO now, not BHO. I need to update that. Mental health or substance use diagnosis or treatment, 120% federal poverty level. Again, eviction notice, behind on rent, or proof of homelessness. HARPS kind of goes a month at a time, so it really depends on the situation. There are versions of this that can go longer, called long-term HARPS, but typically it's kind of case by case. So we kind of start at just a month. It can pay for housing programs like Oxford, and in some cases can pay for household needs. So the rapid rehousing programs, all at the bare minimum, we kind of focus the rapid rehousing plus on more high barrier, but at the heart of it, the basic restrictions are pretty similar. So there's really no income, just that they're currently homeless. That's essentially it. They need to be unhoused. Kitsap County is the grantor, and it's households experiencing homelessness. And for the move-in only, that's really, just kind of in the name, is the entire move-in cost. So we can cover admin, first, last, really whatever they need. In certain cases, we can pay family or friends if they're holding a lease. It's a little tricky, but we can do that. And the clients find the landlord on their own. Very similar to our regular rapid rehousing, except there's 6 months. And then the clients pay a percentage of income. So the clients will cover all of it the first month, then they'll pay 20% of the income, then 35, and then 50. So the idea is that they pay a greater and greater amount. So the plus, same thing, except we actually help look for housing in this case, but the main criteria is that they're unhoused. We talked a little bit about this, the PSH for CHF, permanent supportive housing for chronically homeless families. And the head of household needs to have a disability and chronically homeless. They need to have at least one dependent in the household. So under 18 or a dependent adult can count if they have a qualifying disability. This one does have an income. They need to be under 50% area median income, and this is permanent. And so the households just pay 30% of their income, and it does not end. So here is the ROAST high barrier. I think we talked about this, but this is on the stabilization side, not the rent side. So they have to have that mental health, substance use diagnosis, high barrier, and high utilizer of county services. So this was used to be the original package of this program was part of the Kitsap Connect program, and we helped do some of the case management work there. And so this is some of the piece of that we've kind of taken over and continue. So that's why we have some of the focus on the high utilizers still. But HSC still refers into this client. And then our housing units, all the folks need to be experiencing homelessness with dependents under 18. And Our emergency is designed to be 3 months. Our transitional is a year, can do a year extension. Our COC transitional funded units, 1 to 2 years. And the amazing thing about our COC transitional, that's a partnership with Bremerton Housing Authority, is that if they participate in the program, they can graduate with a housing choice voucher. So that's long-term stability. Kcr transitional, typically we help them leave with rapid rehousing to have kind of a soft landing into the rental market. And then long-term housing is also a partnership with Bremerton Housing Authority. They're funded through project-based vouchers. It can be a year plus. We try to focus here on chronically homeless household. And like I said, it's a partnership with Bremerton Housing Authority. And then TRAP. So here's the main for the rent assistance side, the eviction prevention. And so focus on vulnerable community members, 50% area median income, at risk of housing instability affected by COVID. I need to update this. So now it's actually up to 18 months and 3 months of future rent. And it can go up to 150% fair market rate with the lease. Without a lease, it's a little more tricky. We can also pay utilities, and in certain cases, family or friends, but again, it's kind of tricky, and it's a process the navigator can walk through. And right now, it's a lot more flexible in source documentation. We can self-declare or use a fact-based proxy, which we do have to help move folks through quickly. And here's mortgage assistance, 80%, and they do need, I guess not a lease, so that would be a mortgage statement. So I'll definitely correct this by the time we send it out. But this is folks that live outside the city of Bremerton, but are Kitsap County residents. And this is a 6-month rent assistance or mortgage assistance program. And I believe that is it. So thank you so much, everyone. I really appreciate it. We will hang around a little bit and answer questions from the live chat, or folks, if they can unmute themselves. I'm not sure if you'll be able to unmute yourself, but if so, we can actually have a conversation, or in the live chat, and I will just answer it. So we will be around for a little bit. But we appreciate you all. We'll send out this PowerPoint, contact information for whoever is interested, and we'll go from there. So thank you so much. We appreciate your partnership and looking forward to working together.